Okay, so let's start our discussion. So good morning, everyone. So can you hear me? Am I clear? Okay, so just tell me if you can't hear me and then para maging okay yung discussions natin. Okay, so today we're going to discuss on cardiovascular pathology and I hope to whatever part of this will be discussed today will be a part of the
Sean.
on hello? Examination on next week. Ayan. Okay, in cardiovascular pathology, from the word itself, cardiovascular, now we're talking about diseases affecting the heart and the other structures. Okay. Yeah, so comprising the cardiovascular system. Okay, the learning objectives of this discussion is to discuss the toxic infectious diseases processes which may result in myocardial diseases. So this is very important, no? Especially that the heart is composed most of muscles, and without the activity of these muscles, the animal might die. Again, of course,
Of
it
course, it
describes the
describes the
causations of
causations of
cardiomyopathy. Hello? Medyo may nagbe-feedback. Ewan ko kung sa akin or sa inyo. Ayan, so parang nawala na siya. Okay, so describe the causations of cardiomyopathy. So later we will discuss a portion of some causes of cardiomyopathies. Describe common congenital heart anomalies, explain the pathological diseases processes or disease processes which may be associated with congenital heart anomalies, and identify the different endocardial diseases, pericardial diseases, and vascular diseases. So we have a lot of topics, okay, included in here. Okay, so with the voluminous part or voluminous discussions in the cardiovascular system, so we have here 5 identified topics. So hopefully I could deliver all of this one so that you will be familiar with the abnormalities and diseases. Same with the possible factors affecting the different structures of the cardiovascular system. So at least we have a short review on the anatomy and physiology of the cardiovascular system. That includes blood vessels, the blood, and part of the lymphatics, and and then pathology of the myocardium, pericardium, and endocardium. Different cardiomyopathies, so those affecting the muscle or the myocardium, and then congenital anomalies of the heart and blood vessels, as well as pathology of blood vessels. Okay, to start with, the cardiovascular system in your basic sciences, and of course during your siguro secondary, okay, school or degree, no, the cardiovascular system is known as the circulatory system because it involves the blood vessels, the heart, and of course sa circulatory system kasi the blood itself is included. However, when we talk about the structures comprising the cardiovascular system, we only talk about the heart and the blood vessels. Okay, so these blood vessels could either be the capillaries, the veins, okay, the arteries, and of course some lymphatic vessels. Okay, so the organs and structures which pump, transport, and distribute oxygen, nutrients, and hormones to the different parts of the body through cells and tissues. And then afterwards, collect waste products, particularly of carbon dioxides. Ayan. So the circulating peripheral blood is a mode of transportation of substances and gases. So that's why blood is the component, okay, the component that is being uh, um, guided by, okay, the cardiovascular structures. Okay, and in the composition, okay, of the cardiovascular system are the heart and the blood vessels. Okay, to start with the different composition, let's start with the heart. Now, the heart in your anatomy is consists of three important layers. So we have the pericardium, okay, or the epicardium. Okay, the later now we will see why this epicardium might be somewhat kind of different from the pericardium. However, the pericardium kasi dito, this consists, okay, a portion of the outer layer, okay, outer layer of the heart in which the epicardium is there. And then myocardium's the muscle part of the heart, and the endocardium's the inner, the smooth, okay, the smooth grayish picture or grayish appearance, okay, found when you open the inside of a heart. So this is the structures in constant, okay, tawag dito, exposure to the blood, okay, or the circulating blood. Now, as you can see in the picture, you see here the pericardium, which consists of a fibrous and the visceral layer, or the serous pericardium. Now, the epicardium here consists the visceral layer. Ibig sabihin, ito yung in contact with the muscle part or the myocardium of the heart. Okay, so aside from that, we have here the parietal layer of the serous pericardium and the pericardial cavity. Now, in between the parietal layer and the visceral layer is the pericardial cavity, in which the pericardial fluid is flowing. So this gives uh, parang something that will absorb some stressful or yung shock, okay, in a heart, no? And then, of course, this prevent the collapse, okay, on this area, okay, yung fluid natin. And this pericardial cavity is a part of assessment, okay, in terms of evaluating pathologies of the heart. Okay, and of course, under your endocardium, you see here a lot of structures originating from the layer. So we have the trabecular carneae, okay, and other papillary, ayan, structures can also be found there. The valves are also found there. Okay, so these are the important parts in which you need to be familiarized, especially in evaluating a specific heart sample. Ayan. Okay, so the component, a part of the heart is the blood or are the blood vessels. And the blood vessels consist of the arteries, the veins, and the lymphatics. So we have here a lot of, depending on the sizes, no? So we have the venous system, which comprises the large veins and the small veins, and as well as the capillaries, okay, the end blood vessels, so yung mga capillaries in which exchanges of gases and nutrients and oxygens are being observed. And then we have the arterial system or the arterial part, no, in which arteries, okay, large, small arteries and the arterioles and the terminal arterioles are being seen. And of course, we also see here the lymphatics. So the lymphatic, as we all know, transmit or serves as a blood vessel or a vessel for the transport of lymph. Okay, yung watery, okay, ito yung plasma part, okay, ng blood natin. Okay, so that's how a cardiovascular structures, okay, go hand in hand in the circulation of the blood, okay, so sustaining, okay, a life of a system. Okay, so the heart. Okay, let's start with the anatomy and physiology of the heart. So a heart is a conical muscular organ. So as you can see here in a histopathology or a histology picture in an under light microscopy showing you the muscle. Okay, of course, yung mga ventricles are yung mga chambers. Ayan, the left and right ventricles, the aorta, the opening of the aorta in which there's a valve here. You can see my laser point. Okay, so mga opening na yan. Okay, so these are very vital, no? Okay, its structures and anatomy is very vital. Okay, that it should be evaluated, no, once there are systemic conditions. Ayan. So in mammals and birds, this evolved to form a four-chambered pump with four valves. As you can see, there are different valves. So I hope you still remember those different valves. So two valves which open and closes somewhere in between yung left ventricle to right ventricle to pulmonary, okay, vessels, and at the same time from pulmonary to left aorta, left atrium. And so those are the examples, okay? At saka dun sa may aorta, okay, papunta doon sa left ventricle para out, papunta doon sa aorta, I'm sorry. Okay, so these are mga semilunar valves. And then of course, the atrioventricular and then the mitral valves are also included as part of the valve found in a mammalian and birds heart. Okay, so reptiles and amphibians consist of three chambers, the two atrium and a ventricle. And these are interposed as a pump in the vascular system, with the right side supplying the pulmonary circulations and the left side the systemic circulation. So both, no? So in mammals and reptiles, yung right side supplying the pulmonary circulation and the left side the systemic circulation. Okay. Okay, so this is a morphological picture of an actual heart. So nakikita nyo dito yung interventricular septum. Okay, so this is the pulmonary artery, the aorta. Okay, so this is very important, no, para alam nyo, especially when you're going to cut open a heart. Okay, so this is just a few pictures showing you how the circulation and how the heart at the same time the blood vessels work in an oxygen-rich blood and oxygen-poor blood. Okay, so yan yung makikita nyo how amphibians circulatory system is open. So, ayan yung lungs, skin capillaries, the atrium. Ito yung circulation niya. And then, it's not that too complicated. Okay? So, sa reptiles naman, you have this one. Okay, so ito, meron tayong left systemic aorta included here. Presence of the left systemic aorta. And then, for the mammals and birds, ito din yung kayang circulation. Okay. So yung both ends dyan, yung nasa north part and the sa south part, these are the capillaries. Okay, this is the peripheral capillaries in which exchanges of gases and nutrients and the blood itself, the oxygens, are being conducted. Ayan. So kapag nagkakaroon tayo ng congestions, hyperemia, dyan nagkakaroon ng changes. Okay, dyan yung observation. Okay, so this is just anatomical compartments of the heart. Okay, showing you the different parts and structures labeled. Then at the same time, yung mga valves. Semilunar valves, the tricuspid valve, the bicuspid valves. Okay, so ito yung mga different valves. So, yan. So, ito yung parang cartilage septum. Okay, na makikita nyo in between these chambers. Okay, so heart has a large functional reserves. Why? It needs to be. Kasi that pumps, okay, circulation, that pumps blood in all parts of the body systemically, no? So these large functional reserves being monitored by a Frank-Starling law of the heart, the three phenomenon, and compensatory dilatation and hypertrophy. So these three are very important, no, as a physiological compensatory mechanism or a physiological reactions, okay, to sustain the large functionality or the large functional reserves of the heart. I hope you still remember how Frank-Starling law of the heart explains or discusses. So just a few notes about Frank-Starling law. Parang sasabi, the volume of blood that will enter the heart is the same volume of blood that will be returned to the system. The trip phenomenon naman, so ito naman yung staircase. Okay, so parang increase in the capacity or the pumping, okay, of the heart. Okay, and it is being tawag dito, supplied or supported by mga electrical charges. Okay, so mga trip phenomenon or staircase phenomenon. Okay, compensatory dilatation hypertrophy naman, so this is a capacity of the heart to respond, okay, to existing conditions that needs to, let's say, nagkukulang, okay, there is a problem in the circulations in which there should have a large volume of possible blood to be distributed for the oxygenation. So yung compensatory dilatation in certain instances, okay, nangyayari yan dito sa heart natin. So later we will discuss on the compensatory dilatation. So dilatation, from the word itself, it will dilate, and hypertrophy is the muscle. Okay, so nagkakaroon ng dilatation, hypertrophy just to compensate for the enlargement, or sorry, for the ano yon, yung carry on a large volume, okay, of blood, okay, to be distributed out, okay, into the circulations. So, alalahanin natin, so always remember or consider that compensatory mechanism has its own parang ano lang, degree, okay? So, it's not always or it's not forever that the heart will compensate for the responses, okay, or the conditions. Kasi may saturation point tayo dyan, meron tayong exhaustion point na mangyayari doon sa structures that compensating, okay, for that particular conditions. So for the malfunctions result to circulatory disturbances. So actually, if the functional reserves are not sustained, then it will lead to malfunctions. And these malfunctions could affect the left side or the right side. And the left-sided, the lungs can be affected, or the lungs is also involved or can be involved. And the right side, the affected recipient for that matter, for the circulation, no, pag may abnormalities, is the liver intestine. So usually the right-sided here, it affects the systemic circulations, and the left-sided, it affects the pulmonary circulations. Okay, so for the heart muscle characteristic, so this is in the normal, okay, normal picture or appearance of a normal cardiac muscle, showing cross striations. And all muscle tissue, no, so the cardiac muscle, special muscle, striated siya, okay, it's somewhat like skeletal, but then again, they are involuntary. Okay, so the cross striations depends on the presence of myofilament with isotropic and isotropic bands. Okay, the light and the dark bands. And the nucleus or the nuclei are centrally located. They have syncytial arrangement, ibig sabihin branching arrangement of the fibers with slender anastomosis. Okay, yung mga point of apposition. And then intercalated disc are bright narrow bands demarcating the longitudinal limits of each heart muscle. Kasi when you open a heart, cross-section or longitudinal, meron tayong arrangement. You can see muscle na naka-circular and the other one ay naka-longitudinal. Okay, that's how it's being described. Okay, but definitely, pag nakita nyo, parang siyang naka-bilog-bilog yan pag sa cross-sections. So, small amount of connective tissues containing capillaries and larger vessels between muscle fibers sustain, okay, the life of each muscle fiber. Okay, so yun yung mga component ng cardiac muscle. So, you see here some capillaries in which where blood, okay, or blood vessels, okay, the blood that sustain the heart, okay, pwedeng pumasok dyan, pumasok at lumabas. So this is the endothelial cell of the nucleus, endothelial cell nucleus of the blood vessel. This is the muscle, this is the intercalated disc. Ayan, itong mga yan. And then the muscle cell nucleus. You can see here the striations. You can see here the branching. That's the syncytial arrangement of the muscle. Okay, so showing you a little different orientation. So this is the end, okay, the fiber alignment. Okay, so binucleated, and this is the interstitial spaces. Okay, you see here the striations with myofibrils. Okay, ito yung mga fibrous striations. Ayan. Okay, so this involves in a very strong contraction. Ayan. So, yan. Okay, so for the heart wall, okay, so that consists the epicardium, which is the visceral pericardium, the myocardium, the muscle or the cardiac muscles, and the endocardium is the inner or the lining, okay, lining the chambers and with extending, with projecting structures like the valves or the tendinae and the papillary muscles. Okay, so for the histology, okay, so ito yung itsura ng histology of a typical heart, showing you the blood vessels, at the same time yung muscle and the other layer of the heart wall. Okay, so three layers of the heart wall, the endocardium, which is the visceral pericardium. You have the myocardium and of course the endocardium, which lines, okay, the inner portion. And this consists mesothelium. Okay, ito yung lining, okay, ng mga cavities. Ayan. So yan yung part or structures found in the heart wall. Ayan. So, you can find this kay Di Fiore. So, I got this picture from Di Fiore. So, you can check for this one. This is a histology book. It's an atlas of histology where you can see and be familiarized with the different structures of the heart cross-sectionally under histological appearance. Ayan. So, yan. Okay, that's the epicardium. Okay, epicardium is the visceral pericardium, the myocardium, and then of course the endocardium. Now, you see here sa subendocardium which consists of transition. Okay, dito na nag-iba. Okay, yung portion ng component. Okay, so meron pa rin yung mga muscular or muscle. Hello, nawala ako. Right? Hello, naririnig niyo pa ako?
Yes, Doc.
Yeah, nawala ako, tama? Wala na yung presentation.
Opo, Doc.
Presentation ko. Okay, buti na lang napansin ko. Wait lang. I will upload again the presentation. Okay, can you see now the presentation? Good.
Yes, Doc.
Okay, thank you, Mr. Juriel. Di man matagal, no? Dito ako natapos kanina.
Sa may histology, Doc.
Ito, wait. Ito mga to?
Yes, Doc.
Ayan, okay lang naman. Tama. Dito na ako sa arterial. Those histology shows you yung different orientation lang of to appreciate, okay, yung heart muscles and heart structures. Now, for the arterial supply, it's the coronary arteries, okay? So, this arises from the aorta and sinuses of the valsalva behind the right and left cusp of the aortic valve. So, sa taas, dito. So, ito yung branch, okay? These are branches of the aorta. Okay, ito yung makikita yung mga blood vessels, okay, supporting, okay, or sustaining, okay, the oxygenation, nutrients, etc. dito sa heart. Okay, so ito naman yung kanyang important blood vessels. Okay, for the component of the cardiac conduction, so we have the SA node, AV nodes, and the Purkinje fiber networks. So these are very important, no, to complete the conductive mechanism, conducting power, okay, of the heart pump or yung pumping, okay, capacitor, pumping power niya. Okay, so these also include the pacemakers. Okay, so kasama dyan. So that's why AV node and SA node are here. Okay, so that's very important. Now in your physiology, you will remember that these mga nodes na to help, okay, in the compensating the involuntary, okay, pumping, okay, yung power na yan, okay, of the heart. And this is being supported by neurotransmitters. So I hope you remember your neurotransmitters given by parasympathetic and sympathetic, okay, nervous system. Okay, so napaka-importante alam niyo yon. In your pharmacology, it was being discussed. Okay, so I believe in your LRP kasi a portion of that, okay, actually ginawa ko, so I know that, and you know those different neurotransmitters affecting the activity of the heart. So wag niyo kalilimutan ng epinephrine or norepinephrine, okay, acetylcholine, so, yeah, so those are very important neurotransmitters, at the same time some hormones and conductions. Okay, that helps in the conductions and sustaining the capacity of the heart to pump. Okay, so wag niyong kalilimutan yan. That's why meron tayong tachycardia and bradycardia. So those are effects, okay, of some changes in the environment of the heart. Okay, for the cardiac valves, so this includes tricuspid valve or the right atrioventricular valve. So this can be found in the right part or right portion of the heart. The mitral valve or the left atrioventricular valve. The mitral valve is also known as the ano yung isa? Bicuspid. Okay, and then aortic valve and the pulmonary valve. So this looks like a semilunar valve. Okay, they are also called or commonly called the semilunar valve. Why they're called semilunar? Because they resemble yung half moon daw. That's why it's called semilunar valve. And of course, we have the endocardial cushions. The endocardial cushions is a precursor of the valve cusp. And during the embryonic development, endocardial cushions kasi yung makikita, it's not the in a developing heart, okay, it's not the valve na makikita, but then you have the endocardial cushions. But as the animal develop, okay, this will give rise to valve cusps. Okay, so these are the different valves. Ayan, so doon makikita nyo, this is the tricuspid. Why so tricuspid? Because it completes three, okay, structures in the heart side, and then the bicuspid or the mitral valve in the left side, and then the pulmonary valves. Okay, so yun mga nandyan. Okay, generally the function of the heart maintains adequate blood flow to the peripheral tissues to provide delivery of oxygen and nutrients, removal of waste products such as carbon dioxide and other metabolic byproducts, distribution of hormones and other cell regulators, and maintenance of adequate thermoregulation and urine output. Sabi nga nila, if you have a problem in the heart, also kidney can be affected. Parang body-body kasi sila. Because how much volume is being pumped out from the heart should be the same volume that the kidney should receive during filtration process. So yan. So doon nagkakaroon tayo ng problem. That's why pag nagkaroon tayo ng cardiac problem, tinitignan palagi yung capacity of the or yung viability still ng kidney natin or yung urinary system. Okay? So I hope that gives you a lot of review on the cardiovascular system. Now, for the defense mechanism, the cardiovascular system, you can also read this one under the book of special pathology by McCaven, or the pathologic basis of disease. You can see this one. So under pericardium and myocardium, you have their immunologic responses. It could be hormonal or innate. Okay. So for endocardium naman, the constant flow or yung blood turbulence, okay, in each cardiac chambers. Okay, so ito yung nakakatulong, okay, as their defense mechanism. Immunologic responses, again, so same with in the pericardium and myocardium. For the arteries, veins, and lymph vessels, constant blood flow, the turbulence of blood, yung pressure na meron sa blood, and immunologic responses. Now, for the portal of possible entries ng mga foreign organisms. Okay, so sa pericardium, hematogenous disseminations. When you say hematogenous, they can come through the blood. Okay, foreign body penetrations from reticulum. Okay, ito yung hardware disease in which the reticulum kasi is the most cranial portion, and it appears to be somewhere adjacent at the apex. Okay, okay, adjacent sa apex ng heart natin, heart ng cattle. That's why if there are accumulations of mga sharp objects, okay, sharp objects on the reticulum, so pwede yung matrauma. Okay, the pericardium can be traumatized. Okay, and that could lead to problem. Ito yung sasabing ascending problem, okay, of the heart, okay, infections. Another for endocardium, same, hematogenous disseminations through blood, parasitic migration, especially those mga microfilariae, yan, mga filarial worms, intravenous and intracardiac catheters, yan, lalo na pag gumagamit kayo ng mga bypass surgery or anything that could being induced, okay, induct function. Ayan, so possibility, hello? Nawala ba ako? Hello?
Yes, Doc, nawala ka po.
Naku, Diyos ko. Saan ako nawala, my dear?
Sa may intravenous, Doc, sa catheters.
Okay. Anyway, konti lang pala. Okay, so intravenous catheter, intracardiac catheter. So ito lang, these are traumatic conditions that can be given no once you induce okay mga catheters, and catheters is a solid one kapag palagi yan and long, okay, or wrong or incorrect yung pagpasok mo, especially when you do bypass operations. Ayan, so doon nagkakaroon ng traumatic injuries. Same with the uremia induced vascular damage because of the toxic products with the within the blood, okay, circulating, no? So sabi natin kanina previously I mentioned about the constant exposure of endocardium to blood, okay? So the possible waste products from a dysfunction kidney. Yan. Kasi uremia is the end stage of kidney failure. So that means expected that waste products are not totally excreted out or filtrated. Okay, so possibility it will go back to the circulation and be circulated in other portion of the body, and the endocardium is not exempted. Okay, and then for the myocardium, still hematogenous dissemination. Why? Because there's still capillaries, okay, sustaining a portion of the muscle, the heart. Embolic dissemination of infected material fragments from vegetative endocarditis, lesions of the heart or the coronary arterial tree. So that means that this could be a inherent pag nagkaroon tayo ng infections originating from the heart, okay, it could affect okay the myocardium through, so since may mga connections in the blood vessels, ayan, so embolic disseminations and other okay possible accumulations from okay hematogenous okay circulations and fragments of infections originating or emanating from the endocardium can affect the myocardium. Okay? So for the arteries naman, same hematogenous dissemination, local extension of suppurative necrotizing inflammatory process, immune-mediated arterial injury, and parasitic migration. So just think of how arteries work on circulation, and these structures help in the circulations of blood. So yung ginagawa niyang role, then its exposure to this matter no are very risky. Same with the veins. Kaya kung titignan natin, no, may pagkakatulad in how they're being exposed to some entries of foreign invaders or foreign materials or substances, okay, papunta sa kanila and affect possible pathologies of these structures. For the lymph vessels, hematogenous dissemination, local extension of severe inflammatory processes, and parasitic migration. So these are the portals of entry for the cardiovascular system. Now, if you will notice, paulit-ulit lang siya because they have common exposure to hematogenous dissemination. Okay, so that's the review under the heart. Okay, so are you still with me?
Yes, Doc.
Okay, thank you, Mr. Juriel. Okay, now we start with the pathology of the heart. Now, in the pathology of the heart, we need to consider this. In evaluating pathological changes in heart muscles, attention should be paid to width of the fibers. So ito na yung pinapakita ko sa inyo kanina that you should be familiarized with the structures of myocardium. Okay, so width of the fibers, gaano kakapal. So that means you can assess whether the fibers or the muscles reduce or enlarge. Presence of foreign material. Sarcoplasm. What is sarcoplasm? This is the hello. Ano ang sarcoplasm? Oh, anyone? Ala, nakalimutan yan. You forgot your physiology and anatomy. You have heard about sarcomere. What about sarcoplasm? Yeah. Oh, you review your pathology. So this is a counterpart to ng cytoplasm. Saan? Oh, it's your assignment. Okay, where you can see degenerative changes in which fat or glycogen or other materials can be deposited. Now, the cell nuclei. Okay, you need to check also whether the cell nuclei appears to be there or diminish or wala. Okay, so that means it can entail some possible necrosis. Okay, the cellular constituents of the interstitial tissue. So, ibig sabihin, in between the muscle fibers, okay, yung pinag-usapan natin ng mga capillaries there or other resident cells. Okay, so you need to check whether may accumulation ba ng mga inflammatory cells within those or changes in the cellular constituents of those entities interstitially. Okay, yung mga tissues in between. Okay, so when looking at the valves, so that is in heart muscle assessment of the myocardium. When looking at the valves, so that's for the valves naman, note the vascularization. So the vascularization entails whether my thickening, at the same time, the integrity of the valve, or my paleness, the color. Okay, so those are the changes that could respond to vascularization. The thickening, the presence of, ayun, nasabi ko na lahat, no? So vascularization, valve substances, whether it's thickened or not, and surface deposits. So later kasi we will see there are some deposited materials, okay, especially when you do cardiac, intracardiac injections, etc. And epicardium and pericardium frequently show a coating of fibrin in pathological conditions. So somewhat like an indirect, okay? So kapag may mga progressive inflammatory conditions happen, then epicardium and pericardium are affected. Okay, so this is how you're going to evaluate the structures of the heart. Okay. Now, sectioning the heart, as I mentioned, doon sa intraventricular, okay, septum, no, pwedeng dun yung, ano nyo, directions of cutting to a view, okay, the two plane, okay, yung two plane ng the right and the left portion of the heart, and showing also the cut septum. Okay, so that is how you're going to section the heart when you do or compare the gross pathological changes, okay, to ultrasound taken in the live animal. So, ibig sabihin, pag makita, you see, okay, kapag inopen mo siya, let's say namatay siya, may enlargement doon sa kanyang laboratory findings, then you open which of these two part, okay, shows the enlargement. Is it a diffuse enlargement or a portion enlargement? Kasi later, we will talk about the two picture of hypertrophy. Okay, so meron tayong eccentric and concentric type of hypertrophy, which both could lead to some enlargement of the myocardium. Okay, so postmortem of a fresh heart. So before rigor mortis, it appears flabby and enlarged. Okay, so similarly, it should be differentiated from dilative cardiomyopathy or DCM. And that means dito kasi titingnan sa apex and how the orientation, okay, of the possible heart when it is or it suffered from a conditions leading to dilative cardiomyopathy. So later we will talk about cardiomyopathies. Okay. So for some postmortem changes, you see pale chicken clots or yung chicken fat clots or yung parang yellowish clots. Yellow appearance at one end and red at the other. So ito yung mga yung sinasabi ng postmortem changes. Except kung balot na balot talaga yan ng fat. Okay, that's different. Okay. So commonly found within the atrium and right ventricle upon opening. So sa loob. So this shows a poor erythrocyte, okay, due to severe anemia and after prolonged agonal period. So it can be seen in horses and other septic animals. Okay, pag may septic or may mga systemic conditions, pwedeng makita yan. Okay, so another is the red currant jelly clot in the atria. Ito yung one way to differentiate it from a thrombus. Okay, so it can be found in the right ventricle and large vessels at the base of the heart. Okay, dun sa may aorta. Okay, dun sa may aortic area. The clot is shiny and gelatinous and not attached dun sa kanyang surrounding structure. So that's a current jelly clot, and that is a postmortem clot. Okay. Next is hemoglobin imbibation, especially if there's a prolonged agonal period, o matagal na rin siyang namatay, so hindi nabuksan. So possibility of discoloration. Okay, so since the endocardium and epicardium with erythrocyte lies after death. And you have also the intracardiac injection lesions. Okay, so especially when you see, when you use a euthanizing agent, such as, ito kasi, example ng euthanizing agent, okay, mga lutal. Okay, so it can cause acute hemopericardium, precipitation of some crystalline deposits, okay, pwede sa mga barbiturates, no? And result in myocardial pallor at the site of injection. Okay, kapag, makikita nyo naman kapag intracardiac, and then through and through, makikita nyo na magkakaroon yan ng changes. Okay, just know that as how the animal died, kung ito ba ay namatay or pinatay. Okay, so you need to check on that. Okay. Okay, so for the basic pathophysiological mechanism of cardiovascular dysfunction, so ibig sabihin, this shows you how the possible development of pathology in the heart. Okay. So first is the pump failure. So how pump failure occurs when there's a weak contractility and emptying chambers. So ibig sabihin, yung emptying chambers, the pressure, okay, the power of contractility is affected. Okay, pwedeng ma-reduce. That's why hindi niya lahat napapasok o napupunta. Okay, yung progressive movement, okay, ng blood ay hindi pupunta sa isang chamber. So what happened? Some portion of it, okay, remains in that previous chamber, and then papasukan ulit, so nagkakaroon ng overloading. Okay, so that is one pump failure. Okay. Another is impaired feeling of chambers. Ayun nga. Okay, that's that actually one of the contractility and emptying chambers at the same time, impaired feeling of chambers. Another is obstruction to forward blood flow. So good naman. However, once it should be released in the circulations, whether pulmonary or in the systemic circulations, hindi na siya makalabas. Why? Because of some stenosis. Okay, valvular stenosis, vascular narrowing, or systemic or pulmonary hypertension. So may pressure preventing or impeding for the blood to be released. Okay, and another one is regurgitation or regurgitant blood flow. Ibig sabihin, backflow. So the volume overload of chamber behind failing affected valve. So parang it follows when there is a pump failure. Okay, so meron tayong, okay, pwede siya mag-regurgitate or bumalik. And the valve, the major function of the valve is to prevent the, okay, di ba, backflow of the blood. Because if there's a backflow of the blood, possibility of what? Okay, so magkakaroon tayo ng mixing, okay, or overloading of some chamber. So mas lalong mahihirapan yung heart natin. Another is shunted blood flows from congenital defects. Ibig sabihin, if there are congenital defects, okay, of the heart, when there is septal defects in the heart, shunts between blood vessels, or ito yung mga openings na hindi na-close during development. Rupture of the heart or major blood vessels. This is quite severe kasi meron tayong hemorrhage. Okay, and it could led to death. Okay, so pwedeng mabilis magkaroon ng death because of cardiac tamponade. Dito yung cardiac tamponade pwedeng malunod. Okay, so malunod, so overflowing or masyado overloading of fluid or of blood of the heart. And if that happens, no, the animal might die. And then of course, cardiac conduction disorders means yung arrhythmias. So, walang synchronizations in the cardiac contractions, so affected yung pinag-usapan natin kaninang power of conduction sa contractility, yan, especially the trip phenomenon. Yan. So, those are affected. Okay? So, dito nagkakaroon ng arrhythmias. And it can be assessed through auscultation. So, that's how you're going to use your stethoscope and hear, okay, some sound and rhythm. Okay? So, dun mo tinitignan yung changes whether the heart, okay, the rhythm of the contraction are affected, abnormal, or still normal. Okay, so my pulse rate, yan heart rate, yan yung mga chine-check. These are the external way of looking or evaluating the physiology of the heart. Okay, so for the heart failure, This is also called the cardiac decompensation, the term decompensation. So it appears that it reaches its capacity, okay, to maintain its function. Okay, so inability of the heart to maintain adequate circulations. So this occurs when blood returning to the heart cannot be pumped out at a rate sufficient to meet the metabolic demands of the body. So yung Frank-Starling law is na overcome, no? So parang nawala. Okay, so it does not sustain now the principle of the Frank-Starling law. Okay, so yung volume na pumapasok ay hindi na the same volume na lumalabas kasi it should be because it's the same volume that will recirculated in the body. Okay, oxygenated at the same time with nutrients, etc. Okay, so pag kulang yon, then it will be the circulations or the system, especially those far away, okay, those mga distal portion of the system can be affected. Okay, that's why yung mga part na to pero nagiging bluish na. So those are some of the considerations. Cardiac output is less than venous return. Ayan. So pathological manifestation are found in tissues other than the heart, and this can be found with both left heart failure conditions. So when there is a left heart failure, pulmonary edema congestions can be seen as contributory. And then central-lobar hepatic congestion, generalized edema naman, ito naman itong result once there are problem in the systemic circulation. So nagkakaroon ng central-lobar hepatic congestion, naiipon, and then chances are nahihirapan na siyang bumalik. Okay, because meron tayong problema doon sa circulation. So that's why doon naiipon. Okay, so it follows with the generalized edema. So the plasma component of the blood is also affected, okay, because of the pressure. So categories of heart failure, you have the acute heart failure and the chronic heart failure. For the acute heart failure, it's very sudden. So nandun tayo dun sa transition, no? Significant loss of cardiac breath. It can cause sudden death. A precipitous event leading to brain death because of the oxygenation. So pag walang oxygen sa brain, pwede niyang mamatay within a minute. Okay, so brain death. So if that happens, no, manifestations can be comatose. Okay, another is chronic heart failure. So result of failure of the heart to maintain the adequate circulation over a period of time. And divided into right, I've just mentioned about this one, right-sided heart failure and the left-sided heart failure. So when you say further description of acute, so often there are no premonitory signs of disease, pwedeng mamatay lahat, sudden death. However, there are some causes that could possibly lead, okay, so result indirectly or directly for acute heart failure. We have destruction of big part of myocardium because of infectious or toxic vascular damage, dilated or hypertrophic cardiomyopathy. So the animal might have a history of cardiomyopathy, biglaan, then pwede siyang mamatay because of large enlargement. Cardiac tamponade, so ito pwedeng malunod because of the overloading the chambers and then hindered or impeded to exceeded out or circulated within the circulations. And severe electrolyte imbalance, particularly of potassium. Ayan. Sometimes it can cause potassium in high concentrations, it could lead to cardiotoxicity. In low concentration naman, it affects the rhythm. Okay, so yun yung magiging possibility. These are just one example for the electrolyte imbalances. Other calciums can also be one important because of the contractility, okay, especially the trip phenomenon. Okay, and of course, myocardial ischemia. So you have known what ischemia is, okay? So it is reduction of oxygenation on a certain area, no? And ischemia can be a precedent for infarction. Yeah. So this ischemia cause acute heart failure. So pwede kasing mamatay, okay, yung affected recipient muscle, depending on how extensive, okay, is the ischemic or the affected muscle. So in humans and much less frequently in animals. So that's how it looks like. So for the chronic heart failure naman, we have general causes. So sustained systolic pressure overload, sustained volume overload, there are loss of myocardial contractor capacity, and interference with ventricular filling during diastole. So ibig sabihin, the valve are affected, the pressure, okay, yung pinag-usapan natin kanina na event that yung feeling, okay, ay hindi lumalabas. That's why there is a sustained overload, okay, of blood within chambers because of impediment in the pressure and in the volume. And then loss of contractility, okay, mechanism, especially if there are diseases in the myocardium. Now, if you will notice, so you can see here some of the factors leading to this kind of general causes. Okay, so as for your reading assignments, okay, so you read on the descriptions of left-sided heart failure, particularly the pathophysiology of underlying conditions. That means how, left side heart failure and right side heart failure developed. Aside from what I've just mentioned about, the general description of left and right-sided heart failure. So I think it's already 9. So I will end this portion. Cardiac syncope, acute expression of cardiac disease characterized by collapse, loss of consciousness, and extreme change in heart rate and blood pressure. And the causes of this one could be myocardial necrosis, ventricular fibrillations, heart block, and reflex cardiac inhibition. Now, if you will notice, no, yung kanyang manifestation, napaka-general. So may collapse, bigla siyang nahimatay. So one of your differential diagnosis could be a cardiac syncope. And this may be due to a lot of conditions. Affecting directly, no, yung sa heart, doon mo makikita if there are lesions in the heart. And that could lead to cardiac syncope. Okay? Ayan, so diagnostic procedures na lang to. You can just read on this one. Ayan, so pinapakita lang siya. So we end on the general descriptions of the heart and its pathologies. Okay, so ang myocardium and the rest will be separated. Okay, so siguro enough na yan for, we won't have a big interim examination, but we will have a long examination, parang chapter examination. Okay, so yun ang gagawin natin next meeting. Okay, that will be your part of the midterm. We will have an examination, but more of chapter examination. Okay, so can you still hear me?
Yes po, Doc.
Yes, Doc.
Okay, so I will upload. Hindi ko pa na-upload yung ano, I will upload today. Okay, yung hemopoietic and the cardiovascular. Okay, so dito re-reviewin nyo lang yung mga reading assignments nyo, kasama yung reading assignments plus hanggang dito sa cardiovascular. So the general pathology or pathophysiology of the cardiovascular system. Okay, affecting yung heart. But myocardium and the rest, okay, yung specific diseases or specific conditions of the different structures has different, okay, approaches in the examination. Hanggang dito lang. So from hemopoietic to this. Okay? Clear? Hello? Before I leave you, before you go to your class. Nakuha nyo, guys? O, naririnig nyo pa ako?
Yes, Doc.
Okay. So if you don't have any questions or clarifications, you can just chat or tell to Nicole or dun sa chat box natin or chat account natin, no, sa messenger for your questions. Okay? So that's all for today. Thank you very much and review well. See you next meeting.
Thank you po, Doc.
Thank you.
Thank you po, Doc.